According to the available research, there are more than 200,000 traditional health practitioners in South Africa, compared to approximately 25,000 biomedical doctors. They are often the first and in some places the only medical provider for 85% of the African population. From its early days, the AIDS Foundation of South Africa has recognized traditional healers as playing a significant role in primary healthcare and in the fight against HIV and AIDS in South African communities.
Since 1995, the AIDS Foundation has trained thousands of traditional healers across the country on treatment literacy and on safe practices.
The initial program ran for 6 years, training more than 6,000 traditional medical practitioners in KwaZulu-Natal. It made history as the most extensive of its kind in South Africa, serving as a benchmark for further programs implemented by the Department of Health. AFSA followed up in 2005 with a treatment literacy training program for healers in 6 provinces. This course aimed to dispel myths and inaccuracies around HIV/AIDS being curable through the use of traditional medicines and alternative therapies, and to help traditional healers understand biomedical treatment of opportunistic infections, antiretroviral therapy, and the importance of promoting treatment compliance. The training equipped thousands of traditional healers to deal with HIV/AIDS prevention and management and improved their understanding of the relationship between HIV/AIDS, culture, health, and gender. Over the years, it became clear that the work of traditional healers was not well understood or trusted among biomedical doctors. Healers were expected to refer their patients, but those same patients would then be advised to stop using traditional medicine.
The Culture and Health Programme was established in 2009, and its goal is to improve the health and well-being of culturally marginalised and vulnerable communities in South Africa. We work with a whole range of target groups, and one of them is traditional health practitioners. The reason for working with healers is that the vast majority of South Africans consult with traditional healers of various disciplines, as well as consulting biomedical health practitioners. It's not just for physical health issues, but also for psychological and spiritual issues.
The Culture and Health Program brings together traditional healers with biomedical practitioners, policymakers, and the media to find common ground in their efforts to fight HIV/AIDS and improve lives.
Up to now, the program that the AIDS Foundation has implemented through the Culture and Health Program has helped to facilitate policy forums with traditional healers that were being supported. And this was to help the traditional healers to add a voice on what they wanted to see happening in the ground and across to help facilitate the work that they were doing.
We are working at building a working relationship between traditional healers and biomedical healthcare workers, which are doctors, nurses, pharmacists, around the management of HIV and AIDS.
Traditional health practitioners provide a very holistic approach to healthcare. We are working with a selected group of traditional health practitioners to look at how can they improve the quality of care that patients receive, both by the healers understanding HIV and AIDS and other diseases from a more scientific point of view, but also by health service providers in the public sector having a better understanding of the role of healers and how healers can support patients once they've gone back into community, and also reduce the burden on the healthcare system.
It is very important for traditional healers to work together with biomedical doctors. Before they worked together, traditional healers were believed to be spreading HIV and other diseases. But now they understand the science that is behind medicine, and they use things like gloves when they are examining blood, and they refer patients to clinics. It's also nice for the biomedical doctors to work together with the traditional healers, because now they understand that the medicine can work together with the herbs and the muti that the traditional healer prescribes.
Yeah, like I always go to the traditional healers before I go to the clinic. And the reason is because like clinics, they're long lines there. You spend the whole day just to see a doctor for 5 minutes. And the traditional healers, they can spend a whole day with you looking at your whole body and making sure that everything is okay. And also, like, they play a big role in the community.
The need to involve healers in HIV and AIDS management is widely recognized, largely as a result of AFSA's training interventions since 1995. Organizations such as Mwelela Kweli Pesheya in KwaZulu-Natal and the Standerton Health Practitioners Forum in Mpumalanga have been instrumental in recognizing the importance of developing this reciprocal relationship between traditional healers and biomedical doctors.
We've developed very good partnerships. It was difficult at the beginning because the two were not trusting each other.
In order to enhance traditional healers, training was initiated whereby healers would be trained on conditions like HIV, TB, conditions which are best treated by the doctors, Western doctors, but healers could play a crucial role in prevention of these conditions by early diagnosis and prompt referral to the biomedical doctors.
The Standerton Traditional Health Practitioners Forum has made great strides in promoting the role of traditional health practitioners in formal forums by participating in local, district and provincial AIDS Council meetings, as well as ensuring representation on a number of municipal boards and local governing organizations.
The main vision of Standerton Traditional Healers Forum is to work together with the Department of Health so that the community down there should get better health services, quality health services, and have an easy access to the health care they desire.
Because traditional healers have time for their patients, we feel that they have a better influence on behavior, because one of what drives HIV is behavior change.
Recognizing this, the Nyangazezizwe Community Information Center in Flagstaff, Eastern Cape, engages the community in dialogues that work towards shifting their perceptions on negative cultural practices. These community dialogues, together with the training of traditional healers and care workers, have helped over 30,000 people within the community and significantly decreased the rate of domestic abuse and violence within the area.
Nyangazezizwe organization is not a traditional healers only organization, but a community organization.
Nyangazezizwe also provides computer and internet access, computer literacy training and sewing classes, allowing community members the opportunity to develop income-generating skills. The well-stocked vegetable garden at the center serves to provide the elderly and sick with an important source of nutrients, while the medical plants and traditional pharmacy help to provide relief to the symptoms of the sick. Dr. Kuloko, founder of Suwela Sonke organization, which operates in the Hammersdale community in KwaZulu-Natal, also works towards improving the health, social and economic well-being of the community.
We are teaching about HIV and AIDS and culture and medicinal plants and how and what medicine are now can't be found and the medicine which we can still get in the areas.
Working together with the Silver Glen Nursery in Durban, Dr. Kuloko is committed to educating traditional healers on the uses of traditional plants and herbal medicine, as well as emphasizing the importance of harvesting the plants sustainably. The trade in traditional medicines in South Africa is estimated to be worth 2.9 billion rand per year. With 27 million consumers, the trade is vibrant and widespread. Up until the development of the Warwick Junction Herb Market in Durban, the trade in traditional medicine in this area was largely informal. Tobias Mkize was part of developing the formalized herb market together with the eThekwini municipality.
The herb traders in this herb bridge market are all having their database, which is kept with the office of the informal trader, which is in keeping also with the new Act of the Traditional Healers, where there will be a database that will be kept for the traditional healers, so that every practice will be under control.
For many people in South Africa, traditional medicine is not an inferior alternative to Western medicine, but a desirable and necessary method for treating a wide variety of health problems. In 2004, the South African government enacted the Traditional Health Practitioners Act to integrate traditional healers into the national primary health care system. Following this, the Traditional Health Practitioners Council of South Africa was formed to provide a regulatory framework to ensure the efficacy, safety and quality of traditional health care services.
Standerton has managed to collaborate with the health department and the clinics around them, and that is the model that the AIDS Foundation would like to see happening in all the other provinces as a good practice and as a good model. And we are hoping that the traditional healer policy will be implemented in full force across the country.
What is most important is to focus on the patient, because it's the patient and our communities that must benefit out of the partnership.